Generally speaking, you might have issues with maybe abdominal discomfort, diarrhea, and maybe some nausea and vomiting. I have to say that again, a lot of people probably don't even will have any symptoms if they eat some E. coli, and again, that just goes to what we were talking before, that there's a lot of opportunities for you to get to ingest E. coli, but again, most of the time is something that doesn't sound pleasant, but it doesn't cause a lot of diseases. In this particular case with this E. coli strain, it's basically a kind of E. coli that has the characteristic of producing a toxin that is called a Shiga toxin. And this toxin might trigger certain inflammatory reactions in the body, and it can trigger some other problems. And that's why we are so worried about this E. coli 015787, just because we know that that serotype is usually associated with this toxin production. Not all the times, but most of them produces this toxin. And again, a lot of people might not have any symptoms at all, but some of them might have major complications, and that's when they can develop what we call hemolytic uremic syndrome. What this toxin is going to trigger is an inflammatory response that is going to destroy red blood cells, so patients might present with anemia, so you will present maybe with some pallor in your, your conjunctiva or your face, feeling weak, and in addition to that, patient might develop renal failure. So what kind of things you might have with that? Well, some patients might develop decreasing the amount of urine they produce. The urine is going to look more concentrated, darker than usual, and patients are also going to feel tired and sick in general. Well, usually it's contaminated. It's a contaminated water or food, and again, that just goes to the not so pleasant idea that we probably eat contaminated products without even realize it, despite all the efforts and all the legislation. If you go to a pond that might not be clean enough and you drink part of that water, you could be eating E. coli right there. And again, you don't want to maybe think much about that, but that might be another ways to get this infection. But by far, this infection enters through your mouth. Well, they have to be very careful with the food that they purchase first, and how you cook your meals. So, for example, if you like to eat meat, I would recommend to cook it thoroughly. And if somebody, for example, if you ask for a thoroughly cooked beef patty on your hamburger, and for some reason that's not the case, my recommendation will be to ask for a new hamburger, not just changing the patty, because if it's infected, then it can contaminate other parts of your hamburger, and that goes for other kinds of meals as well. Ideally, you should stay away from any unpasteurized product like raw milk or raw apple cider, and be very careful what kind of water you're drinking. The laboratory will be able to perform what it's called a pulse field gel electrophoresis, which is just a special test, and where they're gonna take samples of these E. coli, and they're gonna process that with some special enzymes, and they're gonna break this E. coli in some pieces, and they will put that in a special test, and it will leave some special marks in a piece of paper or agarose gel, and they can compare that with other marks. So in a way, it's like a fingerprint. So each bacteria will have certain pattern, and there is actually a library, you want to consider that, where they have these fingerprints, and they can compare them with the ones that I'm sure they're running right now, and say whether this is something new or this is something that has been seen before. Interestingly, some people think that actually giving antibiotics in those cases might not be a good idea. Actually, some people think that giving antibiotics in that particular setting might make things worse. So, so in a way, the treatment is pretty much supportive. You know, they have renal failure, well, they might need to be on dialysis. They have anemia, well, maybe they're going to need maybe some transfusions. Some people might benefit to do some other things like plasmapheresis, which is just to try to filter that excessive molecules triggering that inflammatory response. But usually antibiotics are not required in this situation. So it just depends on the kind of E. coli infection we're talking about. So unless you're having any problems with symptoms that might sound like E. coli, like diarrhea or bloody diarrhea especially, or abdominal discomfort and nausea, and maybe some changes in the urine production that they notice that they're not urinating as much as before, then that's the person that I will recommend to go to the emergency room or talk to the primary care providers and get a stool sample, and the laboratory can run that test and see whether this is E. coli or 15787 or some other things that may cause diarrhea, which are numerous.